Hello and welcome to Houselux Estate, the channel that seeks to enlighten you on all things psychological. We're here to peel back the layers of the human mind, to delve into the intricacies that shape our thoughts, our behaviors, and our lives. Our mission is to provide you with valuable insights into the complexities of the mind, demystifying the often misunderstood world of psychology. We aim to empower you with the knowledge to understand and cope with psychological issues that you or your loved ones may be facing. We believe that understanding is the first step towards healing, and we're here to guide you on that journey. In our quest to illuminate the corners of the human psyche, we cover a wide range of topics, from mental health disorders to the psychology of everyday life. Today, we delve into the realm of trauma, identifying its 10 most common signs. First on our list is the experience of recurrent unwanted memories. Trauma can leave a lasting imprint on your mind, causing you to relive the traumatic event over and over again. These memories can be intrusive, popping up at the most inopportune times and causing significant distress and discomfort. They can be vivid and detailed, making it feel as though you're experiencing the trauma all over again. The mind's natural tendency to replay these memories can make it difficult to focus on the present and move forward. It's like being stuck in a loop, with the same distressing scene playing on repeat. This can be incredibly challenging to cope with, but it's important to remember that it's a common response to trauma. This is a very common symptom, but remember, each person's experience with trauma is unique. It's not a sign of weakness, but rather a sign that something significant and distressing has happened, and it needs to be addressed. Next, we have emotional numbness. This is a state where you may feel detached from your emotions, almost as if you're watching your life from the outside looking in. It's like being in a room filled with music, but you can't hear the melodies or feel the rhythm. This numbness is not just about sadness or happiness. It can extend to all emotions, leaving you feeling disconnected from joy, anger, fear, and even love. But why does this happen? Well, trauma can be so overwhelming that it triggers your mind's defense mechanisms. Your mind, in its attempt to protect you from further emotional pain, can make you emotionally numb. It's as if your mind builds a wall around your heart, blocking out any emotional stimuli. This wall may protect you from pain, but it also isolates you from experiencing joy, love, and other positive emotions. This can be a coping mechanism, as the mind tries to shield itself from further emotional pain. The third sign we're looking at is difficulty maintaining relationships. Trauma can leave deep emotional scars, often making it challenging for individuals to form and sustain connections with others. This difficulty can stem from a fear of vulnerability or a subconscious need to protect oneself from potential harm. It's as if the trauma has built an invisible wall, hindering the ability to trust, empathize, and connect on a deeper level. Furthermore, trauma can sometimes trigger aggressive behavior. This is a defense mechanism, a way for the individual to guard their emotional well-being. It's not that they want to push people away, rather it's an unconscious reaction, a protective measure against perceived threats that might not even exist. Remember, these manifestations aren't intentional. They are responses to a past traumatic experience. Understanding this can help us approach those affected with more compassion and patience. This sign can manifest in various ways, from withdrawal to aggressive behavior. The fourth sign of trauma is distorted self-perception. This is a complex and deeply rooted symptom, often manifesting as a negative self-image. Trauma can warp the lens through which we view ourselves, like a funhouse mirror that twists and contorts our self-perception. Individuals who've experienced trauma may start to see themselves as flawed or broken. They might feel they're unworthy of love, respect, or kindness. This distorted self-perception can be akin to wearing tinted glasses that color their world with shades of self-doubt and self-criticism. Moreover, it's not unusual for those struggling with this symptom to blame themselves for the traumatic event, even when it's clear they're not at fault. This misplaced sense of guilt only serves to further erode their self-esteem, creating a vicious cycle that's difficult to break. This sign can be particularly damaging as it can lead to feelings of worthlessness and despair. It's a stark reminder of how trauma can profoundly impact a person's relationship with themselves. Next on our list is the presence of physical symptoms. Trauma, while often viewed as an emotional or psychological issue, can manifest physically in a variety of ways. It's not uncommon for individuals who've experienced trauma to report physical symptoms that may seem unrelated to their traumatic experience. These can include headaches, a common complaint that can be brought on by the stress and tension trauma often induces. Stomach aches, too, are a frequent symptom, as trauma can upset the digestive system. Fatigue is another common manifestation. Despite getting adequate sleep, individuals may feel constantly drained or exhausted, a result of their body being in a constant state of stress or fight or flight response. It's important to note that these physical symptoms are not all in the head. They are very real and can be quite debilitating. These symptoms can often be confusing as they may seem unrelated to the traumatic event, but understanding them as a possible sign of trauma can be a crucial step in seeking help. The sixth sign of trauma is changes in personality or behavior. This sign is often overlooked, but it's crucial to understanding the full impact of trauma. When a person experiences a traumatic event, it can shake up their world, leading to noticeable changes in how they act or who they seem to be. You might observe shifts in their mood or demeanor, alterations in their usual habits or routines, or even changes in their interests and passions. This is because trauma can alter the brain's structure and function, affecting the way a person thinks, feels, and behaves. It's like their internal compass has been recalibrated, and they're navigating life on a different course. You might notice them becoming more withdrawn, aggressive, or unpredictable. Or perhaps they've become unusually anxious or depressed. It's important to remember that everyone reacts to trauma differently, and these changes can manifest in countless ways. These changes can be sudden or gradual, but they are usually consistent and lasting. Next up is difficulty concentrating. Trauma can make the world seem like a whirlwind of chaos and confusion. It's like trying to read a book in a storm. The words are there, but they're constantly being blurred and swept away. This is because trauma can disrupt the brain's natural rhythm, making it harder to focus, process information, and make decisions. You might find yourself rereading the same paragraph over and over, or you might struggle to follow a conversation. It's not that you're not trying, it's that your brain is too busy trying to process and cope with the trauma. This difficulty in concentrating isn't limited to cognitive tasks. It can extend to physical activities too, like coordinating movements or maintaining balance. This can affect various aspects of a person's life, from work performance to personal relationships. When the mind is constantly pulled back to the trauma, it's hard to be present in the moment. And being present is crucial for concentration, for connection, and for healing. The eighth sign of trauma is being constantly on guard. This heightened state of alertness, often referred to as hypervigilance, can be a direct result of a traumatic experience. It's as if the mind's alarm system is perpetually set to high, leading to a state of stress and anxiety that is near constant. Imagine walking on a tightrope, with your senses acutely tuned to any hint of danger. You're constantly scanning the environment, anticipating potential threats, and preparing to react. It's a survival instinct gone into overdrive, a relic from our ancient past when danger lurked at every corner. This hypervigilance can also manifest in an emotional sense. People may be on guard for any signs of emotional danger, such as criticism or rejection. This constant state of readiness to defend oneself can be incredibly taxing, leading to feelings of exhaustion and burnout. This sign can be exhausting as the person is always anticipating danger. The ninth sign of trauma is self-destructive behavior. This is a serious manifestation of trauma that often indicates a deep-seated struggle. Trauma can lead to a pattern of behaviors that are harmful to the individual, both physically and emotionally. Consider this. When someone is in pain, they might seek relief through various means, some of which can be harmful. For instance, substance abuse, be it alcohol or drugs, is a common form of self-destructive behavior. The person might use these substances as a way to escape from their painful memories or feelings, but in the process, they are causing more harm to their bodies and minds. Another form of self-destructive behavior is self-harm, where the person inflicts physical harm on themselves, perhaps as a way to externalize their internal pain. This is a particularly distressing sign as it shows the person is in deep emotional distress. This sign is a serious cry for help and should not be ignored. It's vital to reach out to professionals and support networks if you or someone you know exhibits self-destructive behavior. The final sign of trauma we're discussing today is trouble sleeping. This can manifest in various ways, such as insomnia, frequent awakenings, or nightmares. Trauma can disrupt the sleep-wake cycle, making it difficult for the brain to transition into the restorative stages of sleep. This might be due to heightened anxiety or a subconscious fear of re-experiencing traumatic events in dreams. Nightmares, particularly those that replay the traumatic event, are a common occurrence. These distressing dreams can make the idea of sleep itself daunting, leading to a vicious cycle of sleep avoidance and increasing fatigue. Furthermore, the lack of quality sleep can have a domino effect, influencing many aspects of daily life. It can lead to difficulties in concentration, mood swings, and even physical symptoms like headaches and a weakened immune system. This sign can further exacerbate other symptoms of trauma, as lack of sleep can affect both physical and mental health. Let's recap what we've learned today about the 10 signs of trauma. We started off with the first sign, recurrent unwanted memories that persistently haunt the person. This was followed by emotional numbness, a state where feelings are dulled or absent. The third sign was difficulty maintaining relationships, as trauma can strain personal connections. Sign 4, distorted self-perception, dealt with how trauma can warp one's self-image. We then moved on to physical symptoms, which can manifest due to psychological distress. Changes in personality or behavior marked the 6th sign, while the 7th was difficulty concentrating, an often overlooked symptom. Being constantly on guard, hypervigilance was the 8th sign. The 9th sign, self-destructive behavior, is a cry for help that needs immediate attention. Lastly, we discussed trouble sleeping, a common indicator of trauma. Remember, if you or someone you know is showing these signs, seek professional help. Thank you for joining us at Houselux Estate today. Don't forget to subscribe for more enlightening content.